No, that's so intellectually bankrupt and dishonest and corrupt. They were all reported as COVID.
But, even if, let's just say that they did report them as flu cases, this kind of logic, this kind of thinking that they keep rolling out, that, look, if we can save any lives, it is worth doing this one thing or that one thing. So if they could find any evidence that if everyone wears masks, it saves, 1% of all deaths to the flu, then they're going to support it. And they're going to tell everyone, you need to wear masks all the time. So about a week ago, it had been 100 days since Joe Biden told all of us, hey, guys, I just need you to mask up for 100 days. Then this will be all behind us. And no, I guess he didn't quite get that right. So we still have to mask up. And then Fauci, he was on Meet the Press on Sunday. And Chuck Todd asked him, at what point can we stop wearing masks outside? At what point, if vaccinated people get together, do you take the masks off? Is mask wearing going to be something we have with us in a seasonal aspect? And then Fauci's response was, well, we should probably just keep masking up forever. because we didn't have any flu cases last year.
Oh, no, was that his reason? I haven't read the story yet. Was that his reasoning? It wasn't that they were all freaking misreported as COVID-19?
I think people have gotten used to the fact that wearing this is Fauci, that wearing masks, clearly, if you look at the data, diminishes respiratory diseases. We've had practically a non-existent flu season this
charlatan!
year.
You are an intellectual fraud!
Merely because people were doing the kinds of public health things that were directed predominantly against COVID-19.
No, that is not true. Then why in the world do Asian countries still experience the flu? If masks take care of it, tell our official representative from the Asian peoples, Brian Chai, if masks fix the flu, why do we still see flu in Asian countries? I demand you answer this right now.
Oh, it's not called the flu in Asia.
Oh, that's a
semantic argument. All right, fair enough. Fair enough. No, that's so intellectually bankrupt and dishonest and corrupt. They were all reported as COVID.
But, even if, let's just say that they did report them as flu cases, this kind of logic, this kind of thinking that they keep rolling out, that, look, if we can save any lives, it is worth doing this one thing or that one thing. So if they could find any evidence that if everyone wears masks, it saves, 1% of all deaths to the flu, then they're going to support it. And they're going to tell everyone, you need to wear masks all the time.
To save a life.
To save a life. To save that one life. So
interesting how that argument doesn't work when we're talking about like abortion or something.
There's lots of things. Yeah, there's lots of things that it doesn't apply to.
Sugar consumption, marijuana usage, drug usage.
Well, drug usage would be a big one.
There was a big paper written in economics, I think it was back in the 70s, that argued you could essentially bring automobile deaths, you could essentially decrease the number to zero if you simply installed a giant, sharp spike into the steering wheel, such that if you have an accident, you are likely to impale yourself. That would provide people incentive.
Well, and that would save lives.
One of our commentary writers at the Western Journal, Samantha Chang, she's puts out fantastic work for us. She wrote about this for us, and she said, for the record, never leaving your house could potentially reduce your chances of getting hit by a car, but no one would consider that a useful health tip.
That's good. Is there anything more fundamental to human existence than just breathing, just taking a breath of air? I mean, this is so grim and gruesome in a. I'm not even sure the term for it, but it's this idea that you're having to moderate the thing that keeps you alive.
Well, my thoughts on this were,
out of fear of dying.
At the heat of the pandemic, obviously, COVID was very dangerous for, the older population, for people that were super at high risk. That was a small subset of the population, but they were at extreme risk. During the time when it was going around like crazy, I was totally fine with wearing a mask. I had no problem with that. But now, everybody that's in danger is getting the vaccine or has the option to. Wearing a mask at this point is ridiculous. And the even more ridiculous is the fact that Fauci recommends that children wear masks even when they're outside. And we know that children have like 0 chance of dying of the disease. And it's not. I think there's been lots of doctors that have advised against children wearing the mask because, they do have a harder time breathing than like full-grown adults.
Yeah.